We've looked at how complaints impact on the health of doctors in terms of psychological morbidity, but we've also examined how these complaints processes impact on how they practice medicine. We found that there's a significant impact on doctors' health. If you look at the top end of the complaint scale with the General Medical Council, 25% of doctors had moderate to severe depression, and high numbers of doctors had moderate to severe anxiety. And it's important to remember that this level of depression and anxiety will make it very difficult for doctors to actually carry out their job properly. We also found a large number of doctors had thoughts of committing suicide, which perhaps is very relevant when you look at the recent report from the GMC, which came out only just before Christmas, on doctors who do actually commit suicide. The other side of the coin, we looked at how doctors change their practice. We looked at two ways of assessing that: hedging and avoidance. Hedging is where doctors perhaps prescribe more than they would do normally, or refer, or look for more tests, order more x-rays, which obviously has a cost implication and is not good for patients. And then you have avoidance, where doctors don't carry out procedures, avoid difficult patients, abandon procedures early, which again clearly has implications for patient care. And surprisingly, we found across the board, 80% of doctors reported that they had changed how they practiced. About 80% said that they had exhibited hedging behaviours, such as referring too many patients and so on. And about 40% had reported avoidance, abandoning procedures early or not taking on difficult cases. Quite clearly, this is not good for patient care. We also found that people reported that they had ordered invasive procedures against their clinical judgment in over 20% of cases, purely because they were concerned about complaints processes. Another important finding, in view of the sort of need for transparency and openness, was that 20% of doctors said they felt they were being involved in a complaints process, or a complaint had been made about them because they had whistleblown. And that obviously is a concern given the importance to that given in the NHS today. And about 40% of doctors said they'd been bullied whilst going through the procedure. Now, if we look at the implications of our findings, we think this is very important for policymakers, because clearly if you have a process that is causing damage to doctors, making them psychologically unwell, which in all probability means they're not going to be doing their job terribly well, because remember, if you have severe depression or anxiety, it will impact on your empathy, it will impact on your ability to do your job. Never mind the other side of the coin, which we found, where we have hedging and avoidance behaviours, which means that patients are being potentially over-investigated, over-referred and under-treated. Our feeling is that these data and others mean that someone has to take an independent, close look at this whole complaints pyramid, if you like, so that people feel safe to speak out, that we can learn when mistakes happen and improve patient care. It doesn't seem, from what we've seen at least, that this is what happens with the current complaints process.